The people, I think, are the most important parts of any training program. You can go at a lot of places and get really great training. That's the goal, right? And you are going to get wonderful training here, but you're going to be happy here.
Our training program, our psychology internship and fellowship programs are very competitive across the country.
The Bingham Clinic is over 100 years old.
So we have a child clinical and pediatric psychology internship. We've been APA accredited since 1987, so we have a long history with our internship. We have pediatric psychology fellowships, and we've been able to grow those fellowship offerings.
One of the things we think is really special about our division is that it is combined with psychiatry, with child psychiatry.
Because we're all in the same hallways, there's the sort of design collaboration where if I have a patient who I'm working with who needs some specific ongoing psychological care or psychotherapy, I can make that referral and we can stay in communication very easily.
You get to hear a lot about the different types of medications and how they interact with each other, what might they be used for in terms of both their intended use but then their secondary use, like for eating disorders. There might be medications that wouldn't be what we would think of as psychologists. So I think it helps me have a greater understanding of the world that my patients are entering, but also the people I'm interacting with on a daily basis. When we think about training, it's a full breadth. It's not pigeonholing yourself into one category or another. You get the child clinical, you get the testing, and you get the pediatrics, which is a more rare experience to have.
I believe that our program offers the psychology trainee a full range of child clinical and pediatric psychology experiences.
So we're working with physicians, we're working with social work, we're working with child life, and so providing services to meet the patient where they are across areas.
The didactics are taught by both of our psychology and psychiatry faculty, which allows for each discipline to learn various things from the experts in those fields. We also have weekly professional conferences like journal clubs, case conferences, and grand rounds, which are attended by psychiatry and psychology trainees and faculty alike.
The really exciting thing is that the physicians are all asking for psychology to be added to their clinics. And so I see further growth in the future in just about any area that could be imagined.
We're treating the whole child and not just their medical concern, but making sure that we're taking that comprehensive approach to patient care.
We do not foster competition amongst our trainees. We prefer to have a collaborative model where everyone's learning from one another and supporting one another.
You not only get support on how to be a great clinician, but also how do you have work-life balance? How do you set boundaries? How do you make sure that you're living your best life while also having a great work life?
We have a saying over at the Bingham Clinic, which is where we're housed, that once a part of the Bingham family, always a part of the Bingham family.
We want to support each other and we want to see each other succeed.